It's Thursday, September 19th, and this is the Daily Medical News, where we bring you the day's top clinical medicine headlines and a closer look at today's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, infective endocarditis cases linked to drug abuse are spiking.
The incidence of rheumatoid arthritis in the U.S. is outpacing the rest of the world.
Why Rivaroxaban monotherapy may be the right choice in AFib after PCI.
And platelet-rich plasma may improve hair growth in androgenetic alopecia.
Plus, why angina in a stable patient who's had an MI should raise a big red flag.
Hospitalizations for infective endocarditis linked with drug abuse doubled in the U.S. from 2002 to 2016. It's a trend investigators call alarming, and it's tied to a concurrent rise in opioid abuse. That's according to findings published in the Journal of the American Heart Association. Researchers at the Cleveland Clinic looked at U.S. records for nearly 1 million infective endocarditis hospitalizations. All U.S. regions saw increases in drug abuse-linked cases of infective endocarditis as a share of such hospitalizations. The incidence of drug abuse-associated cases rose from 48 per 100,000 population in 2002 to 79 per 100,000 in 2016. The Midwest saw the greatest rise, with an annual percent increase of nearly 5%. Patients with drug abuse-associated cases tended to be younger, poorer, white males. The study authors say the findings argue for better treatment for opioid addiction after hospitalization, as well as greater efforts to make drug rehabilitation available after discharge.
Three major indicators of rheumatoid arthritis burden in the United States all rose more rapidly than did global averages from 1990 to 2017. That's the key finding from an analysis of RA activity in 195 countries. Researchers at Tabriz University of Medical Sciences in Iran found that percentage changes in the incidence, prevalence, and disability-adjusted life years for RA all reached double digits in the U.S. over the study period. But global increases for those measures stayed in the single digits, except for disability-adjusted life years, which did not increase. By 2017, RA incidence in the U.S. had risen to 23 cases per 100,000. In contrast, overall incidence for the 195 countries included in the study was 15 cases per 100,000 in 2017. RA rates in the U.S. in 2017 were not the world's highest. The United Kingdom achieved the RA trifecta of highest incidence, highest prevalence, and highest rate of disability-adjusted life years among the study's entire 195 countries. These data appear in the Annals of Rheumatic Diseases.
Rivaroxaban monotherapy is a better choice than combo therapy in post-PCI patients with AFib and stable coronary artery disease. In the AFIRE trial of nearly 2,000 Japanese patients, Rivaroxaban alone topped Rivaroxaban and an antiplatelet agent as follow-up therapy at least 1 year after a revascularization procedure. Monotherapy delivered significantly fewer deaths and bleeding events than combo therapy. Researchers from the Tohoku University in Sendai, Japan, presented the trial results at the annual Congress of the European Society of Cardiology. What was particularly surprising was monotherapy's pronounced advantage in all-cause and cardiovascular mortality. The hazard ratio favoring monotherapy was 9.7. That number prompted an early end to the multi-site trial. The researchers note that once the 1-year post-PCI mark is reached, current guidelines recommend monotherapy with an oral anticoagulant if AFib persists and the patient has stable coronary artery disease. But evidence from randomized, controlled trials is backing that approach isn't available, and many patients continue to receive combo therapy. The new study results validate the guideline-recommended monotherapy approach. And as one expert at the meeting noted, stopping antiplatelet therapy at 1 year is safer than continuation, and, most of all, it saves lives. We'll be back with more medical news after this message.
Intradermal injections of autologous platelet-rich plasma topped placebo at increasing hair density in men and women with androgenic alopecia. Autologous platelet-rich plasma, or PRP, contains cytokines and growth factors believed to play a role in new hair growth, but clinical evidence of its efficacy is limited, and PRP is not approved for hair loss treatment. So researchers at University Hospital Cologne in Germany conducted a meta-analysis of 7 PRP treatment studies. Of the 7 studies, 5 reported statistically significant increases in hair density in favor of PRP over placebo. The remaining 2 studies found no significant treatment effect. In the 7 studies, the pooled mean difference in increasing hair density between treatment and placebo was 30, but the 95% confidence interval ranged from 1.8 to 59. These findings appear in the Journal of Cosmetic Dermatology.
Angina should now be a red flag when you're following patients after a myocardial infarction. In a study of nearly 33,000 patients, those with angina who were more than 3 months out from a prior MI had a significantly greater rate of subsequent cardiovascular death or non-fatal MI. Angina and prior MI should now be viewed as a higher risk subgroup that may warrant more intensive management, according to Dr. Emmanuel Sorbet of Avicenne Hospital in Bobigny, France. Dr. Sorbet presented the study results at the annual Congress of the European Society of Cardiology. Researchers reviewed data from patients in 45 countries with stable coronary artery disease enrolled in the Clarify registry. 60% of the patients had an MI more than 3 months prior to enrollment. In that subgroup, angina at baseline was linked with a 3.6% absolute increase in the rate of cardiovascular death or non-fatal MI during a median 5-year follow-up. That's compared with post-MI patients who didn't have angina at baseline. Those numbers translate into a 44% relative increase that remained significant after adjustment for several demographic and clinical factors. Dr. Sanjay Sharma is a professor of inherited cardiac diseases and sports cardiology at St. George's University in London. He says the angina finding should immediately influence practice. And that's it for today's Daily Medical News. Remember to check out the latest episodes of the MD Edge Dermatology Weekly and Blood and Cancer podcasts. They're available today and every Thursday. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.